Hands up. I think a bit better, but for room for improvement. So we are coming back to the concluding session, and we will conclude at the end, but I have been going from room to room and seeing a lot of debates today. So yesterday we had a more plenary, today it was more discussion. So what I propose is that we will take 10 or so minutes for each group and to summarize the conclusions, ideas, the knowledge and practical experience from the field and what you wish to do further. And we go group by group. So I understand that there are also rapporteurs. Some groups have managed to develop slides. So that amazes me always in Ukraine, that if even you start without any materials in the morning, you always have everything done by the evening, because we need to prepare for the next day. So should we have the first group? I think the first group was looking to the services, or what was the word?
Strengthening prevention management.
And which is the strengthen the prevention and management in the NCDs in health settings. Please. You were together?
Yeah, we were together. We were co-moderators. Can we have the slides? Thank you. So this was as fast as I could write during the session. So we had presentations from which described the work of the World Bank and Swiss WHO supported projects, which have been taking place in 7 oblasts. And we also then looked in depth at the evaluation of these, and we started the session looking at some of the evidence-based approaches to changing clinical practice and some of the supportive measures in the health systems that are needed. So in conclusions, so evidence-based approaches to changing clinical practice exist, and we tried to use these throughout these projects, and we looked at how we'd done that. We demonstrated that change was possible, so there were improvements in training, in the process measures, for example, greater measurement of recording of smoking and BMI and so on in the intervention clinics, and improvements in the satisfaction of the patients and the healthcare workers involved. We also showed that there had been reorganization of care and distribution of tasks between doctors, nurses and managements in some cases, and we demonstrated how important it was to do that. The evaluation also identified barriers which persist, such as lack of time and equipment, and some of the very difficult circumstances that healthcare workers have to work in, particularly in rural areas, and that broader organisational changes are needed to support the work. We showed the importance of data, not just for monitoring and evaluation, but for timely feedback, for improving quality of care, and for managing patients, working out which patients need greater focus and which ones can be seen less frequently. All the partners present were willing to continue their support on this work, but we also identified leaders and champions and institutions who were also enthusiastic to continue this work and support each other. And the evaluation needs to be finalised, and then the many lessons learnt can inform the future work in primary healthcare, whether as projects or as major programme scale-up. And if I take 2 of the quotes from the qualitative study, we've managed to switch primary healthcare to prevention, and we realised that the health of Ukraine is in our hands, and that was a comment that came from a family doctor. And then priorities for further actions. We need to consolidate the work of the project so far and mainstream it so we don't lose what we've gained. People, for example, might need to refresh some of the learning or the training or re-practice or refresh some of the skills and be given the opportunity to continue to practice those. We need to improve the education system, drawing on the lessons learned so that the human resources, the workers within primary healthcare are fit for purpose and for non-communicable diseases. We need to, as we said, complete the evaluation and the learning and communicate the results so it really informs change. There's a lot of rich information that's come out of it. Continue to collect and use data to inform practice and quality of care. Communicate to the authorities the barriers that have been identified and see if these can be overcome. Build on what works well. As I said, we've identified champions. How can they continue to support the learning from each other, for example, in peer-to-peer support, and to strengthen the role of nurses and then enable them to expand their roles. There's a lot of potential there, but there may also be some regulatory and educational barriers which hold them back. Thank you. And do you want to add anything to any of that? It's my co-moderator.
Dear colleagues, I think that we have discussed
стосуються впровадження наших нових методів.
Introduction of the new methods of work and what is needed for us to be efficient. But we discussed this in our audience, and if the colleagues who were present at other sessions have any suggestions or comments with regard to their own practice in terms of using the tools presented by the WHO at the training in our practical area, not in the training activities, but in practice. If you have any suggestions or comments or remarks, please, now it is time. We have a few minutes to discuss this. Those who were at other sessions, plenary sessions, in practice, who had any significant problems or who has some positive examples? We spoke a lot about positive things today. Those who were not part of our session, does anybody have any suggestions? And of course, if you have, then maybe in written form you have all our contact details. You can provide your feedback, your suggestions, and we will be happy to consider them, because I think that despite the fact that this project is coming to an end, this joint project, and we start working independently, the World Health Organization and WHO experts will keep helping us and supporting us. We have WHO office in Ukraine, and we will also always have an opportunity to apply for assistance. I would like to thank all the participants, those who participated actively in the discussion of our problems at the plenary session 1. Thank you.
We go to the second group. And the second group was looking to the communication. And I remember yesterday there was a lot of comments about the communication and how we can use it, and how we can use it also here to have better kind of tackle the NCD challenges. So I understand, Joao, you are almost like in the running pose to come here. So please.
Well, thanks very much, Jarno. Thanks for that introduction. I will make a few comments and summarize very briefly some of the, basically the discussion, and I will share with you some of our conclusions, and I will then hand over to my co-chair also to complete, because we didn't have time to consolidate all the notes. Also, we don't have slides, so you can take these ones out if you like, indeed. So the session was called Changing NCD Risk Behaviors Through Communication. And basically, one of the main aspects discussed was really the importance of using communication as a tool to promote health, particularly to prevent NCDs, and understanding of NCDs related health reforms. So not just in terms of promoting the right behaviors, but also using communication and tools so that population understands the challenges, understands the reforms, you get buy-in into it, and therefore you can move forward with many times reforms which in the beginning are difficult to understand. So the importance of communication from the beginning as a tool for health promotion was really underlined, I would say, by all of the speakers. We had like 6 speakers during the 2 sessions, and we had a really very active and interactive participation. We had people from, communication agencies and people that really are professionals from behavior change and communication. And I think that was really very rich and very insightful and really exciting, I would say. So I've learned a lot, and I think that all of us, we were really satisfied with the session. We also discussed the need to have target messages and to use the right platforms. So it's very important that we cannot spray the message everywhere. Nowadays, with all the new media and the opportunities that we have, the diverse of channels, particularly the digital sphere, it gives us lots of opportunities, but also creates really big challenges. So the need to have appropriate and well-designed communication strategies is very important, and we had really good examples, some of them shown through videos and with examples of campaigns, many of them from Ukraine, which are really very impressive, I have to say. They were really very interesting. We also discussed the need to use communication and behavior change initiatives as part of a comprehensive approach that includes regulation, enforcement, and other measurements together with communication. So quite often we see that even sometimes policymakers with responsibility, they will say, well, we will just inform the population, and they make their choices. Sometimes this is a political choice, is an ideology, but it's wrong. You cannot just change behaviors with information and with education initiatives. Therefore, and you cannot put everything on the shoulders of communication. So you need really to combine the communication efforts with change on the ground, with environmental interventions. So the importance of regulation, enforcement, and all those things was really discussed in the session. And I think we are very strong in saying that communication in itself is not the silver bullet, but should, of course, be part of any of the portfolio of actions of any comprehensive program. Also, the importance of using social marketing techniques, learning from communication people, engaging with them, taking them on our initiatives at the same level. That's not, we are doctors, health professionals, we know nothing about communication normally, or we know very little, and I agree. So therefore, we need to move forward by using the right expertise and engaging with multi-stakeholders is very important. But also it was underlined that we can use emotions to nudge people in the right direction, meaning that if the private sector that sells unhealthy stuff many times uses the right techniques that affect and influence people's behavior, one should be able to use the same type of tools, and of course in an ethical fashion, but we have to use it. We have to be able to use social marketing techniques, which are basically the same that are used in marketing in general. And therefore, we agree that maybe we can get better results by using nudging in the right direction. We also underline that we need to focus on commercial determinants of health like food, alcohol, and tobacco, and a lot is being done by those who sell it and want to sell them. We discussed the particularly the also inappropriate and unhealthy situation in the digital marketing sphere. So we just look at the communication in a positive way, but also looking at the downside in a negative way. So areas where we really need to counteract marketing, areas where we need to regulate and move forward by putting barriers to the industry that affects commercial determinants of health and that selling products that are unhealthy. So a balance between using communication to promote positive behaviors, but also using regulatory tools to restrict marketing where this marketing is, of course, and this communication is unacceptable. And in many instances, we've discussed it, it is unacceptable when it comes to food to children, young people, adolescents, and alcohol, etc., etc. We also finally said that we need to focus on young people and their causes as great opportunities to prevent NCDs. And we've discussed ways to do it. Also, finally, it was a strong focus on ensure citizens participation on the communication initiative. Citizens need to be involved from design, from conceptualization, and delivering these messages really from early stages, notably, from scratch. Basically, I think these were 8 points that we would like to bring for the discussion, and I would now like to give the floor to my co-chair. Thank you.
Дякую, Жао. Насправді дуже важко щось додати, але ми наразі одним із основних досягнень цієї сесії для нас було обговорення національної комунікаційної стратегії з неінфекційних захворювань. І саме отримати відгук на конкретні завдання та дії, які ми пропонували. І ми... Щось з перекладу? І ми наразі отримали...
We have recently received very interesting proposals regarding tools that could help us make this strategy alive and accessible. And here we're talking about producing high quality content that will make it possible to reduce the problem of dissemination, because high quality content will be used by all media campaigns, and then we will not need to pay for its dissemination. This is the message we've received, and we never thought about that in detail. The same can be said about involvement of the communities themselves. Today we are talking about the development of the responsible attitude of the communities to health. Next week a special conference is going to be carried out in Kyiv dedicated to healthy communities and their health-related responsibilities. So here we already can begin thinking about involvement of the communities in thinking about the health of the citizens. I would like to thank all the panelists who have provided us with really cool cases. We've received information about the fact that a new information campaign is going to be launched in Kyiv, the information campaign to prevent alcohol consumption in pregnant women. It will be launched in the beginning of July, and I believe that communication strategy that will start with this campaign is going to be very successful, and you all are going to be witness of this important event. Thank you.
Thank you. And now to the third group, which was discussing the NCD prevention and health promotion in the school setting. We have Martin and Galina. So, please.
Yeah, I'm just opening the stage for Galina. We had a very impressive group presentation of pilot work on health promotion in school with an extremely participatory approach. A huge engaged group who presented their achievements, including improving the food in schools, which I think is a major problem all the time. And then at the end of the session, we agreed on some recommendations, which Galina is going to present.
Thank you very much for so impressive session, because we have... Вибачте, я переходжу на українську. Я дуже дякую всім учасникам.
I would like to thank all the participants for an amazing session. We have a very wide experience of work with the healthcare professionals, but such unification, such bringing together and merging the education, people working in the domain of education and medics was really important to ensure that we have this bridge in between two of us. So we had three subsessions, so to say. First, we talked about the national politics, then we talked about the local politics, including the school policy that was not even discussed. Nobody really discussed. The schools needed to have their own policy regarding health protection of school children and this school staff. And the third point that we have talked about, and we have just started talking about, who is the school nurse, who is it going to be like? What is the training of school nurse? What is the role of school nurse in the school? We have already talked about the already approved concept of the new school, new Ukrainian school, and we've mentioned that this is the health domain, and that without the component, you've seen yesterday, the Ministry of Education, this is competence number 10, and we would like it to be competence number 1. And the issue of health is a very important component. We are talking about promoting healthy lifestyle, which should be a cross-cutting issue. We need to ensure very clear intersectoral approaches. The example of this project should be implemented in everyday life. This should not be spontaneous, but it should be the everyday tool that exists as a part of our everyday life. What do we do to keep up with this dialogue? And I also would like to mention that the National Action Plan was adopted, and it includes a lot of points related to the activities of the Ministry of Education. And we would also like to develop the mechanisms that would guarantee that the Ministry of Education is involved, that it is not going to be lost because the project as it is right now will be gone. We have a lot of instruments that have been developed. We have been throwing all these tools at our participants. They received the guidelines for the teachers. The medical colleges received the guidelines for school nurses. We have developed the index of school health, which is a self-assessment tool. This is not the control instrument. This is the issue of planning that is to take place without the team. And now we need to make certain that these tools are not going to be lost, that they will become an integral part of the educational system. And how do we make certain that these tools are such that are the tools that used by the schools, that it is not used as the assessment instrument, because then everybody is going to hate it. We have not started this project from the scratch. We've had a network of health promotion. This network has died basically, but there's a moment of accreditation, of assessment, self-assessment, planning of the healthy lifestyle. This is the new philosophy that could bring together a new network, and we have been discussing that quite seriously during our session today. We have been talking about the general approach for schools, and everybody agreed that not a single nurse, that a single nurse cannot resolve all the problems within the schools. If we have a model, then it will function. And we indicated that everybody should agree upon that, not under the administrative pressure, but because this motivation is the philosophy of their life. And we have been talking about the mechanism for communication, about influencing the teaching staff, that it should become a part of their lifestyle, basically. I've already mentioned school index, and I would like to mention that when we've started the project, we have 22 pilot schools, and we told them that we're not going to give you kitchens or furniture, we are not going to give you pots. This is simply not a part of the project, but we are going to give you what is most precious, the ideas, the intellect, building your vision. And this is what was very well developed in the pilot regions. And they found the resources in the local communities to ensure the changes. And this is a very important component of this project, when people are the nets that make it possible to catch fish. We are talking about resource mobilization. We paid a lot of attention to that, and we're also talking about the school teams. And we had a very heated debate regarding the school nurses. They've changed their status. They have been transferred to schools, and this is the challenge for schools today. Because the new competences, the question is, how can the nurse become an integral part of the school team? How can this profession become prestigious? This could be school nurse, public health nurse, but the nurse should be present in school. And we've discussed the question of further education, and this is a very important project. We've involved the Ministry of Health and many people who have expressed their opinion on how to make certain that we do not have the best nanny for the lowest possible salary, but how do we ensure that nurse is a really active member of the team. And we also needed to understand what is the school service, what is our competence, education and prevention, or do we transfer to something else? And we've had a very interesting comment made by WHO that we still do not see the overall picture in the country. We do not even see it clearly throughout the regions. And we need to have a very well-structured research that would make it possible for us to understand what is taking place in this sector. Everything that is there at the boundary is the most risky one, and we are there on the border in between the Ministry of Health and Ministry of Education. This is it. I'm very grateful to all of you who have been involved in our plenary discussions. We have talked quite a lot. We have expressed gratitude to all of us who have worked quite seriously in the region, to the people working professionally in the education system. They are the driving force behind everything that is related to children. We have lots of plans, and our pilot experience should be disseminated. This is our key message. We should not stay at the piloting stage. We need to work to disseminate our experience.
Galina, let me add my grain of salt to it, and as we are at the NCD conference, it will be a very small grain of salt altogether. 5 grams? No. 0.5 grams. Now, as Galina said, I mean, a lot of things have been developed, and as usual, after a successful pilot, the most difficult thing is to scale it up to routine practice. And that obviously takes quite a bit of additional discussion to make sure that the regulatory framework is in place, to make sure all the good materials which have been developed can actually be absorbed in routine practice and need some facilitation. And obviously we would like to see this happening, and as WHO would like to support it. And the other thing, as Galina was saying, with the school nurse, we had a very vivid discussion. Expectations are endless on it, salary very limited, and it reminded me very much of a German joke about the animal which every farmer wants to have. You know which animal every farmer wants to have? It's an egg-laying wool milk pig. It lays eggs, it gives milk, it gives wool, and at the end you slaughter it and you have a ham out of it. And at the same time it should not consume any food. So this ideal animal is the school nurse. It should do all roles, and should not cost any, and she should get not any salary or no high salary in it. So obviously we need to manage expectations to some extent and see that we can get a school nurse who can meet the expectations. We have WHO standards for school nurses which need to be managed in the way that they fit into the national system. And of course the biggest question is it health, is it education, how is she going to be line managed, and the most important thing, what is her job description. So these were my 2 grains of salt I wanted to add to it.
Thank you, and I think very good comments, and I think I would like to make one more applause to all the teamwork that has happened in this morning, because I think if we follow up on all those points, then we have work to do for all next 10 years, but then also there are more things to celebrate as well. If there are no more further comments on the group work, and we all agree to follow up, and if we go back from where we started yesterday, that each of us writes down few things we can do really in next day, next week, next months and the years, and we would have much more to report back in a year, 2 time, then I would like to move more to the closure, because also I think then when we go home, we have opportunity to digest, think, but also we will promise that there will be a summary report that we can start to follow up as well. So as I see no more comments now, then I would like to go to the closing session, which are few colleagues sharing their thoughts, ideas from these 2 days, but also from the past and as we are going to the future. And first I would like to give a floor to Nicolas, great friend from our Swiss Development and Cooperation Office, with a team who is also here, and a few wise words from Switzerland, but also a friend of the public health and friend also of a WHO, because we have a great cooperation with the Swiss colleagues, not only in Ukraine, but in many countries. And as I mentioned also yesterday, I would say Switzerland is one of the development partners I have seen over the past decades, one of the brave ones that wants to do always difficult things, and one of these are how to tackle the non-communicable diseases. So thank you in advance also for that. Please.
So thank you very much, Jarno, for these very nice words. I can see that a lot has been achieved during the last 4 years in the framework, especially of this project we had in collaboration with WHO. As also mentioned by Jarno, the question of NCD and health reform is a very long way. I mean, it's maybe a never-ending story in the sense that with especially the progress in medicine and the progress in technique, things are always changing, so we will never achieve at the end one ideal target, but it's more the process to go through improvement in delivery of health in a country, and to fight against a certain number of diseases, and especially non-communicable diseases, which come from very often bad habits, and these bad habits are very long to change as an individual point of view, but also from a collective point of view, in the sense that habits are changing and are improving with the time. And all of us remember maybe 20 or 30 years ago, smoking was considered as being normal, and now it's something which is less and less normal. And I'm sure that in we don't know how many years, 10, 20, 30 years, smoking will be something which will become completely abnormal, and less people will smoke. So a lot has been achieved during this year, and also especially today. I think it was an extremely interesting conference, extremely well organized, with extremely interesting debates and proposals for future. And I think this type of conference gives to all of us food for thought for the way forward and for improving the things in Ukraine. I would like once again to thank WHO for the perfect organization of this event. I would like also to thank the Ministry of Health and the Dr. Ulana Suprun in particular for all what has been achieved during the last 3 years. I think it's very, very impressive to see all these reforms. I know it's a very, very long way to reform a health system, but what has been achieved, I think, it's very, very important. I would like also to thank, you to have been in this conference, and also for all the work you achieve every day, either in ministries or in practice or in university or in different institutions to improve the health of the population. From our side, Switzerland, we have been involved in health for 20 more years now in Ukraine, and we will continue to be involved in health. Now, let's say our focus is clearly the question of Ncds. We have new projects which are running or which we are coming. I can cite, for example, the new project of medical education, which will build knowledge of primary healthcare doctors and nurses to be able to better deliver health at primary healthcare level. Also, I would like to cite a new project which is coming. It's mental health for all. Mental health being one of the big question and big challenge to be solved in Ukraine, because many people are suffering of mental health problem. Statistics say that maybe a third of the population at one point in time everywhere in the world are suffering from such a problem. It is very important that these people are not stigmatized and are able to be cured and to stay in the community, in the society. We are also collaboration with the World Bank, and we will launch a new project related to NCD that will be a rather large project, because we foresee something like 15 million Swiss francs for the next 10 years. So we have also this long-term vision. We will launch very soon a tender for this project that will last for, as I mentioned, 10 years. And we will also, in the framework of this project, collaborate very tightly with WHO for improving the health situation of the Ukrainian population and to continue the reforms. So I would like to thank you all very much for having participating in this conference and for all the work you do every day. Thank you very much.
So, and the next, I would like to give a floor to Bente Mikkelsen from WHO Europe, and I would say the mother of NCD control in our region, before in the world, but now more in the region. That means also closer to Ukraine, please.
So it's always nice to be a mother. Thank you. So first of all, I would like to thank the Ministry of Health of Ukraine with the Minister, Dr. Suprun, for making all this happen. And I think it was impressive to see her engagement, to see how she has sort of allocated all the resources, all of you coming from the ministry and public health institutions. This means a lot. And I think without this kind of ownership, it is not possible able to do anything in the country. We can facilitate, we can do a lot of things, but the ownership has to come from the country itself. So that was a great pleasure. Also, thank you to Swiss Development Agency with Nicolas Gurgas. I think I have used actually the Swiss Development Agency as an example. There are very, very few donors in the world and in the world of NCD actually that have done their support in the way that you have. You have actually trusted your partners. You have sort of been able to co-create and co-design with the country, the partners, the way we are doing things. Most donors, unfortunately, come with a very, very specific request, which is not always helpful for the place where the country is in. So this is remarkable, and I'm very happy to hear that you will continue the good work, both in mental health and in non-communicable diseases. And I think we should try to use the example of SDC also beyond the borders of Ukraine to showcase that this is possibly one of the way that we can live the SDGs and work together in a very powerful partnership. But last, of course, not least at all, is a huge hug, and lots of hugs actually. And thank you to the Country Office of Ukraine that has made this meeting happen. And I must say, I have to admit actually, that when I saw the program, I was a little bit skeptical. I thought this will be maybe one of these meetings where there will be a lot of presentations and not so much interaction. And it's proven to be exactly the opposite. I mean, especially even on the 9th hour or something yesterday, you managed to have a real, vivid and very engaged discussion ongoing with a lot of important, I would say, suggestions. And I think this is really a learning point, because even with the best buys, even with everything we do on a technical level, this is the kind of thing we need, and you know better than anybody else what needs to be done. So I look forward to your next exercise and a summary from this as well. So coming more back to key messages. What I will remember from these days is also coming from the Ministry of Health. We are talking about prioritization, and of course we want to do that from a technical point of view, and we do, and I think that is where WHO is very well sort of positioned. We are able to sort of use data to really compile science, to develop as well science and tools. But what is extremely important is to use this in a context, and I was thrilled to hear yesterday that one of the criteria for prioritization in this country with the new government was to choose things that as many as possible could feel the difference of the intervention. That was a very, very smart way, and an extremely challenging way as well. But I think that was really something I will sort of bring with me. And I think, of course, it was very close to my heart that then the thing to prioritize was really to strengthen the I would say the primary level of the healthcare system, namely the GPs, and really see how this in such a short time frame we're able to develop. This is really, really a fantastic example. The other thing came from today's discussion, and it came from the World Bank. It was Tanya, and I'm sure I will not pronounce her surname correctly, Dimitrachenko, who reminded us that as much as we look into dollars and the money side of things and investment cases, it's really about human capital. And I think the way the World Bank now is using human capital as a measure and as also an indicator of positive achievements, this is something we really need to look into. And coming from a World Bank position, that she said that actually in Ukraine, only 65% of the population gained their level of productivity, and that the gap was because of the NCDs. So they, from this analysis, they know, from the World Bank position, know that they have to really look into how we can beat NCDs. This is extremely important. This is at the same level for me as something also Suprun was commenting on the first day, which actually the president of ICRC were the first one to say, and it was an eye-opener for me. He said, and she also mentioned this, that actually in the areas of war, more people got their legs amputated because of lack of insulin and proper diabetes treatment than from landmines and sort of the pure nature of the armed conflicts. So again, telling us that when we are so engaged in NCD, this is for a real reason. We are not only discussing this theoretical, it is about the country's prospects and possibility for development. And I would like to, it's pretty serious on this sort of last day of the conference, but I think this is also something to bring with us. On a little bit more cheerful side, I mean, I had to ask Jill, was this really said? And she said this was qualitative assessments of the health system strengthening project. And it was stated that we managed to switch primary health care to prevention. If that is the perception and the reality, this is astonishing. This is really the Astana, this is really what we want to see, and this is probably the way forward. And also the health of Ukraine is in our hands. I mean, if this is statements that comes out from qualitative assessment and research, this is really something we should put, in our heart and also remember from this project. I mentioned the power of partnership, and I think we cannot speak to that too seldom. We really need to look for partners. We have implementing partners who have spoken in the meeting, who has told us from a family doctor perspective, from NGO perspective, from donor perspective, how they actually used all the knowledge coming into this project. And this is what we need to do. It's not possible for the government, not possible for WHO. We have to do this together. So this is also something I think we got so clearly demonstrated. And of course, there are always possibilities for improvement. I'm sure we can even broaden our sort of constituency, our sort of partnership to many other partners as well. And this is probably something we all need to look into for the future. Then I want to remind you, because we haven't sort of come back to that so much during the conference, but actually Ukraine was the place where the regional office saw the pattern that we are now calling missing men the first time, I think. So this is a country where sort of we are talking about nobody left behind, and this is one of the countries where we see men is left behind. So I hope that you could go on our webpage from the regional office and look at a very interesting video. It's a video about Jim from Ireland, and it really tells the story on what we need to do to get men to use healthcare system, to really look into how we can support men's health in a better way, not sort of as a priority over women's health, but actually as a support to also women's health, because what is good for one gender is usually good for both genders. So it's not sort of the one over the other, but we need to really look into that. So what you see by looking into the missing men, you see the sort of inequity in the country and also in Ukraine. So please have a look and think about this. I will soon end. So I think from today we have heard more about data and communication, and it can never be sort of underscored enough. And I think one of the experiences, my personal experience coming to Ukraine 1 year ago, was actually that we had not been able to communicate what we have achieved in the project. So people said, is anything actually happening in this project? And then when I came, I realized, yes, of course, we really had worked hard. We had achieved things. So communication about achievement, using data for improvement, and also, of course, to continue to develop new tools. So I think I will end there. And of course, this is not the end of the project. We have not achieved the SDG targets. We have to continue our work. And I really look forward to the next time to come and work with all of you. And thank you for all the inspiration. Thank you.
Thank you. So, I will say a few words and then over to the Ministry of Health also after. So, first, thank you for coming, being. And I think you will enjoy also the videos you look after, and you look also very good in all those videos, I think. So that's what and we can see how we became more active and slimmer as we go ahead. But I wanted to say, I think, 3 sections on WHO's behalf, a little bit about the project, because it links a little bit to this, and then about the conference we are. And the conference will be the shortest because I think Bente just summarized it very well on certain things that we are taking away from this meeting, and we will have also many summary points from the sessions we just summarized just ago. First of all, I want to thank you, our Swiss partners, again, because of the trust, collaboration, because we have been engaging extensively because of the Swiss support also in the past years. And I think that's one of the few countries that our team has prioritized in such a level. I've been working as a WHO representative now more than 15 years in different settings, and it's not very often that you see the director and majority of the program managers of one program to come to one country. Usually we are one in one country, another one in another country, because we have 53 countries to serve in our region, and globally even more. So I think this type of extensive engagement is because we have also friends in Switzerland, and what Bente also mentioned. On the sad note, today is also part of the closure of one phase of the conference and handover of many of the products to all of you to take it further and to scale up, to work, and we are available, aware, and looking how the things are going, but we might not be with you always as intensively also. But we are looking to the opportunities to also work together with you, and with many partners we make it happen. So I just wanted to say thank you for all of you, because you're coming also from different regions. We are implementing different difficult areas of work, be it on tobacco control, or you work on in the schools and you figure out what is the school nurses doing, or what you can do at the local level. And many of you have been trying to put NCDs into the agenda at your oblast development plan, or developing a separate plan. So you have found a very innovative ways to actually address the NCDs in different parts of Ukraine. And I think this is something really you need to cherish, take forward, and also tell the story, because sometimes in health sector we feel that not everything goes perfectly. We have so high expectations always, so even if we have a success we think, okay, we should have done more. But I think you should really, one takeaway message from the whole conference is that it is really a lot what you have done. And why I mentioned I have been doing this work for 15 years, I have seen rarely a country who has done so much as you have done. So I really want to thank you for all of that. That's beautiful what you have done. So we continue with you, with many other partners. Today we had in the room, and yesterday, the World Bank, the European Union colleagues, the CDC, the Swiss. So actually, what has happened in the past few years, with all of your support, many development partners have also started to look to the NCD agenda. So I think it gives us also the opportunities in the future as well. And we as a WHO, we take away also many of the messages from this 2 days meeting. We are now doing our planning for the years 2020, 2023. So we remain optimistic that all of what you have been doing, we can follow up. Because also WHO becomes much more country-focused. We look around how to make the world safer, but also universal health coverage and better health. So actually what we have discussed last 2 days, I think Dr. Tedros would be very happy to hear back, because what you do, we would wish many countries to do. So this is about on behalf of WHO. So work well done, many things to learn, and we are with you. About the project we have been doing, because I don't like to talk about the projects, because projects start and end, and it's always very sad. So I like more to talk about the programs, the priorities we have, and we will always find a way how to do more, better, and together. So, but as we are at the end of certain projects, so I really wanted to thank those who have been here around the project, but also the WHO team, because we have they have been behind this initiative and taking it further. And probably I will forget to say all of them, but we have Anastasia, Natalia, Maria, Olga, Oksana, Anna's are actually two running around in the room, but also we have famous Luigi, I think somewhere, also who is our NCD guy, and he comes back every month here to check that if everything is on the track. So I think this is all also because of them, who have been working with you. And I would like to thank also from the WHO side for the trust that you trust them and you work together. So thank you all for the trust, and this also possibility to work together. There are many things that we have done together in this brochure, and actually this brochure is really as a short abstract of the scientific article, because there is much more that have been done. So I want to thank you for the trust, and that this project also carries a lot of positive vibes to the future. So thank you. And now finally about the conference. I think the conference has been beautiful, bringing together the health system transformation of Ukraine, NCDs, universal health coverage, and the development agenda. I think that is unique and very, very timely. I'm very happy that this meeting starts now and the discussion is very lively, because I think that helps us also to convey the message as NCDs, as a priority topic in the volatile times that we have in Ukraine. So I think having a first ever NCD conference, I don't know how the ministry picked the time, but you picked it very well. So I hope that it helps also to carry on the NCD messages, related messages in Ukraine to the future as well. I thanked already the development partners, and I would just say that I will read this conference report, I think, for the next 10 years and find every day something to follow up. So we will do the report, we will share it with you, and then we can follow up. And just before I give over to the Ministry of Health, I just wanted to thank you all those who are behind the scenes, because we have interpreters who have been working tirelessly across the 2 days. We have the video crew who has made it happen, that actually we can have meetings here, but also many colleagues are following up, and not only in Ukraine, but worldwide. I have got SMSs and messages from other countries who are very interested how the debate goes on in Ukraine, and also thank all of you for the active participation. So thank you, and see you again, and now over to the Ministry.
Good day once again to all of you. This is a great honor for me to participate in the closure of this event. The last 5 minutes, I been inspired by all the presentation. I've been sending out invitations to healthcare workers to participate in a large scale flash mob in Mariinsky Park, open air yoga. So this would be words to action and going to the recommendation to move more, and we could directly implement the ideas we have been discussing today. But let's go back to the serious note. What I would like all of us to remember, what I've remembered as a result of this conference, there is enough of evidence implemented at the international level that would make it possible for us to move forward to prevent and combat NCD. You know that there are tools, you know that there is evidence, and they can be used. These tools is something that you take with you in brochures, in your heads, and I would go as far as would suggest using these instruments in future, not inventing the bicycles as we used to do that in the country. So these tools are more than enough. They can be implemented at the national level. They can be implemented at the level of a doctor. And if we talk about the practices that are called best buys, there are 88 of them. This is a huge work, and we are aware of the effectiveness of the international. 16 of them are unique and effective. So this is what we needed to remember. There are the necessary tools. We needed to remember about them. We all have been talking about the primary level, and the primary level is the forward of the reform, and it is the primary level that the reform in the secondary network is going to rely upon, and we hope that the changes have been unstoppable, the changes for the better. At the same time, I understand that there are still lots of changes and requests toward the primary level. And so the doctors who are part of the primary level, we expect you to take the prevention as a part of your practice, because you work with the patients, you see them, you talk to them. Even the smoke, the discussion about smoking, I understand that this is a 5-minute talk, but international studies demonstrated that it increases a request of the patients to stop smoking. Same can be said about alcohol. 5 minutes of your time are invaluable. Huge number of articles have been written about that. This is just an example. This is an intervention saying that you should not be doing that. But this is a huge challenge. Tobacco smoking, a healthy diet. If the patients talk to you, this is called universal health. This is the universal medical assistance. And the General UN Assembly was recently dedicated to health. It will take place in September, and the primary level will be discussed as the forerunner in this process. So Ukraine is quite timely from the global perspective, and we are now being transformed. We demonstrate that we are part of the global content, and this is very important for you to understand that internationally there is this transformation of the role of the primary level that would make it possible to introduce the universal coverage. We have enough experience that has proven that if we act in this and that way using this or that tools, we will have a positive changes. We are quite used to saying that many people die from non-infection diseases. Men have a 10-year smaller life expectancy compared to women, and this is unacceptable. But there are also positive examples. You've heard about the positive Ukrainian example in the domain of control of tobacco. We smoke less, and this has positive outcomes. The same can be said about alcohol. We are not the leaders of alcohol consumption, and we consume less and less alcohol. We have also heard that during 6 months, the program of affordable drugs, a number of emergency addresses dropped within only 6 months of the program. So accessible medications also are important in this regard. We've talked a lot about the community leaders, about the networks. The yesterday's session demonstrated to me personally that at the national level it is possible to do quite a lot. But when we talk about non-infection diseases, non-communicable diseases, many things reach us through the hospitals, and it requires leadership and involvement of the citizens, not only at the level of regulation. Through regulation, we can do less compared to the work at the community level. Money is important. We will never have enough money.
And best practices sometimes do not require any funds. To ban advertisement or access to alcohol does not require money. It will bring more money in the budget. What is needed is political will, leadership, and I want to say that with regard to the project, what are we working for? We're working for raising life duration and quality. This is a subjective category. At the moment, I don't have the data with regard to quality of life, but with regard to life expectancy in 2013-14, compared to that time, life expectancy increased in Ukraine by 6 months. This is very insignificant data, but this is 6 months of life. Among men, in general, 9 months, in women, 3 months. That is why, with reflection to the men's health issue, if we want to progress in terms of life expectancy, men are the most neglected group of people, and through them we can increase significantly the life expectancy, and this we should pay attention to that. And I'm happy to know that the WHO has men's health program, and it includes a number of activities. I'm really grateful to our partners that we were able within a few months to organize this conference, and within a few years to raise awareness of non-communicable diseases. And I would like to thank Mr. Nikola and Bente Mikkelsen for coming here, for being with us for these 2 days. And in general, the WHO, Dr. Jano and his team, I wish you success and see you next time.
Now it's a possibility to go to lunch. And don't be afraid, I will not do any more speeches today. So big hug to everybody. Have a lunch, enjoy, and don't forget to do at least 3 things next year to improve the situation in Ukraine. Thank you.